Hi everyone, this is Dr. Stefan. In this video, I'd like to tell you about a condition called idiopathic pulmonary fibrosis, or IPF. So IPF is a very strange condition. It is a condition that does not have a known cause, and this is why we call it idiopathic. Basically, idiopathic just means unknown cause. Pulmonary fibrosis just means lung scarring, so scarring of the lung tissue, hardening of the lung tissue. Now, idiopathic pulmonary fibrosis, even though it doesn't have a known cause, it does have certain features that can distinguish it from other conditions that affect the lungs, from other forms of lung scarring. It is, however, a very difficult condition to manage. The reason for that is that the fibrosis, the scarring of the lung, is progressive. So over time, it tends to get worse and worse and worse. So the lungs become harder and harder, and breathing becomes more difficult. Now, usually it can have a fairly rapid progression. So in the course of, 3 to 4 to 5 years, patients can get into a fairly bad state. So this is why it's really important to catch IPF as early as possible, because there are treatments called antifibrotic treatments or anti-scarring medication that can actually slow down this process quite a lot by having basically the rate of progression, the rate of decline in lung function. So it's a very, very important condition to diagnose and treat early. Now, how is IPF or idiopathic pulmonary fibrosis diagnosed? Now, this is usually diagnosed in individuals who have symptoms such as shortness of breath and a cough. And this can be progressive over a number of months or years. So generally, it's a condition that affects elderly individuals. So generally after the age of 60, even 70. So it's a condition of an older individual who, at this age, you might think that they may slow down, they may become more breathless, and we may put this down to aging, but sometimes it can actually be the fibrosis. And it's really important to note this because sometimes you have people who can live up into their 80s, 90s, even more towards 100, and still be functional individuals and have a lot of gas in the tank. So I think for anyone who is really struggling with their breathing, they seem to be more tired, they seem to be declining in the ability to do daily activities, I think it's really important to look into why that is. And it can be down to a number of causes. It can be related to the heart, it can be related to, anemia, to lung conditions, to other things. So pulmonary fibrosis in itself is quite rare. Idiopathic pulmonary fibrosis, so having lung scarring of an unknown cause, so it just sort of comes out of the blue, we can't really find the cause for it. It's very rare within the rare, but it is important to keep that in mind. So if your doctor does an assessment of your breathlessness, your cough, and they discover there is a little bit of scarring on the lungs, maybe on a chest x-ray, or maybe they hear some crackles on your lungs that sound in a specific way, they may recommend doing a chest CT, so a scan of your chest. Now, the scan of your chest, if it's done as a high-resolution scan, it generally highlights areas of scarring on the lungs in idiopathic pulmonary fibrosis. There are certain patterns on the CT scan that a radiologist will be able to tease out that are suggestive of this diagnosis. So if those patterns are there, and the pattern is called usual interstitial pneumonia, or UIP. You don't have to remember these things. These are just bits of terminology that doctors use. But if this pattern is found in the scan, the likelihood of having idiopathic pulmonary fibrosis is very high, especially if the patient is the right age and if there are no environmental exposures and no other significant conditions that can be found to explain the findings. Now, if that pattern is found, then we need to try to rule out potential causes. So what happens then is that your doctor or your healthcare team may request further tests. They may request something called an autoimmune screen. So this is basically a blood test that looks at certain proteins in the blood, antibodies or autoantibodies. So these are proteins that are directed by your immune tissue against healthy tissues of your own body. So it leads to autoimmune disease. And certain autoimmune conditions where your body's immune system goes into overdrive, there can be an effect on the lungs as well. There can be scarring of the lungs in these conditions as well. But if nothing is found on this autoimmune panel, there is no sign of rheumatological disease such as rheumatoid arthritis or other autoimmune conditions, again, the likelihood of having idiopathic pulmonary fibrosis increases. The other thing your doctor may ask you is if you've ever been exposed to things in the environment. So things like asbestos. If you've been exposed to asbestos, again, there is a possibility that the lung scarring may be related to that, but it depends how significant that exposure was. If the exposure was only brief, and you weren't really breathing in asbestos fibers, was suspended in the air for a long period of time, it's unlikely that it would explain the entirety of the findings of fibrosis on the lungs. So ruling out certain environmental causes, ruling out certain autoimmune conditions or other conditions of the body that may lead to pulmonary fibrosis, and having a compatible pattern on the CT scan can actually lead to this diagnosis of idiopathic pulmonary fibrosis, because we have scarring on the lungs of a certain pattern compatible, and we can't really find a cause that explains that. So that's when we call it idiopathic pulmonary fibrosis. This is an umbrella term, so it covers many types of patients who may have the more rapid or more slow progression. It depends. So, but if you have this diagnosis of idiopathic pulmonary fibrosis, it's really important to seek treatment, because there are treatments called antifibrotic medications, like I mentioned at this moment when I'm publishing this video in March 2023. We have two antifibrotic treatments which are available. One of them is called pirfenidone, the other one is called nintedanib. They both seem to be working in more or less the same way. They tend to reduce the rate of decline, the rate of worsening in your lung function if you have IPF, by about half. So this is important because it means that over a year, if you're, say, losing 200 milliliters of lung capacity, if you take this medication and you're able to tolerate it well, that rate may be reduced to about half, so maybe about 100 milliliters, which may not seem much, may not seem like a big change, but over 5 years or more, it can make a significant difference to how you will end up. The medication, called antifibrotic medication, so this does not reverse the scarring process. So it does not make the lungs better and the way they were before. This is quite unfortunate. There's lots of research in the area now to try to find a cure for pulmonary fibrosis, but at this moment we are stuck with these two medications that slow down the scarring process, which is still a much better outcome than letting the condition run its course, which may be quite rapid. In certain individuals, in a few years, you may end up being quite poorly if you have IPF. But with the medication, generally, you tend to buy more time. You tend to have a better quality of life for a longer period of time. But it's important to note that it's a fairly serious condition. It needs to be caught early. So that's why I would suggest, like I was saying at the beginning of the video, if you do experience problems with breathlessness on exertion, if you're unable to do as much as you could, you're having respiratory symptoms, you're coughing, there's something that doesn't feel right, do go and check with your doctor to see if there may be pulmonary fibrosis, for example, or another cause. It's not always idiopathic pulmonary fibrosis, but this is a diagnosis that you don't want to miss. So this was this quick video. I just wanted to tell you about this condition called idiopathic pulmonary fibrosis, a very significant, serious conditions of the lungs. And please check with your doctor if you have respiratory symptoms, even if it's something else. It may be something that is easily treatable, but yeah, this is something we don't want to miss. Thank you for watching my video. All the best, good health. And if you have further questions, leave them in the comment section below. I'll try to answer in future videos like this one. All the best.